So many people are wondering what we should be doing when it comes to keeping COVID at bay. Luckily, we got Dr. Kohli here to fill us in. Plus, we also want to get to the bottom of some of these other medical news, okay? First of all, you look beautiful. Hello. I love it.
Happy Women's Day.
Happy Women's Day.
Yes.
Okay, so with COVID mandates changing, and a lot of our viewers have these very same questions, many of us are confused. What should we be doing right now? And just give us like the lay of the land of where COVID is right now.
I have to be honest, I'm confused too. So I went to a meeting this weekend with a bunch of doctors, and I didn't know what to do. I had my mask in my purse. I said, should I put it on? Should I not? I walked into the conference room, sort of read the room, most people not wearing a mask, so I left it in the purse. That is not where we should be. We should really be using a more methodical way to assess what we're doing. And I look at two metrics. One is your individual and family risk, and the second is your community level of transmission. So if you're low, your risk is low, family's risk is low, community risk is low, put that mask away. That's the time we're in right now. But if you're high, then you got to wear that mask. And if you're somewhere in the middle, then it really has to be an individual decision. But one thing we all have to do, no matter what our risk, is respect each other's choices. So if you see somebody with a mask, respect it. If you see somebody without a mask, respect that as well. Because I think we've done a lot of mask shaming or no mask shaming, in the last couple of years. But now we're in a different phase of the pandemic, and we shouldn't judge people for not wearing a mask.
I appreciate you saying that, but I think we also need to clarify that's if masks are optional, because there are still spaces
you're right.
where masks aren't optional.
That's a great point. So on the airplane, for example, it's a federal law to wear your mask. Most people wear the mask to board the plane, and then I noticed they took it off. One couple was making out, another guy snoring without his mask on. And I wanted to go up to them and tell them that this is not the right space to exercise your personal choice, because we still, of course, have to respect the laws of our country as well.
Totally agree. So the Florida Department of Health is saying that healthy children between the ages of 5 and 11, I'm reading this because I want to get it right, should not get vaccinated. This goes against the CDC. So should healthy kids be vaccinated in your opinion?
110%. The science does not support not vaccinating our healthy children. It's almost like not making a deposit in their immune system savings bank. If you vaccinate your child, Jeff, you're going to cut their risk of getting into the hospital by half. That is a huge reward for really not much risk at all. And I like to use a raincoat analogy. So when it's pouring rain outside, how well is a raincoat going to protect you? Not very well, right? You'll still put it on your child, but not very well. So that 12% number that we're getting on the vaccine only working 12% for kids, it was during the Omicron peak, when there was just raining outside, and that's why the vaccine wasn't working. Now that the numbers have gone down, putting that raincoat on your child is going to keep them dry, so that efficacy of the vaccine is going to go up if you vaccinate your child.
Let me push back real quickly. What if the chances of rain is 0.000? Would you bring an umbrella out with you?
Yeah, no. Not if the chances of rain are, but we have to be clear, there's still infection in our community. So it is raining outside, and no parent would send their child out when it's raining without a raincoat, which is why when the chances of rain become 000.
Right, but isn't that what it is for children?
No, because children can still get infected. So the chances of rain depend on how much infection is in the community, not the...
But their chances of mortality is like 0.0001, right?
You're talking about deaths, Jeff, but what about the fact that your
I know, I'm just pushing back a little.
Shrink?
It's Women's Day. I figured I'd ruffle some feathers.
Your brain can shrink after you get COVID. We just found that in adults.
What is that? So people that have had mild COVID cases, their gray matter is disappearing?
Yes, on MRI. And heart disease goes up, cancer risk can go up, clotting can go up, stroke can go up. So we don't even know the long-term effects.
That's a great point. Yes.
Thank you, Dr. Kohli. If you have a question you want answered by Dr. Kohli, make sure that you write us in.